Back. It is Wednesday, Wellness Wednesday, and Breast Cancer Awareness Month is October. For today's segment, Dr. Ken Stewart of KCU Joplin is joining us to talk about how early detection is almost always the key to successful outcomes. And the doctor and I were talking before we actually went on the air, and I'll bet this is true for almost everyone watching. We all have personal experiences with people, close people in our lives, who we've lost to breast cancer.
Yes.
You, for instance.
Yes. So my mother passed away at 53 of breast cancer, and then my sister-in-law died at 42 of breast cancer. So I'm very passionate about educating people about breast cancer awareness. And I think education goes a long way in helping identify and prevent, breast cancer from occurring.
And it seems to me like in the past 15 to 20 years, maybe it was the American Cancer Society, I don't know who it was, but somebody did an astonishingly good job of keeping that awareness alive. And you're doing this as well by coming on Living Well and talking about that. But I think more people are very aware of the dangers than they were 2 decades ago.
And you hit the nail on the head, Gary. Really being able to identify breast cancer early is the best way to be able to treat it. And so, women being aware of how to examine their breasts on a monthly basis, we usually talk about women starting from the age of 16 to 20 that they start examining their breasts at home, do self-breast exams, and usually do it about 7 to 10 days after they start their menstrual cycle, and that way the breasts aren't as tender. From 20 on up, we usually recommend that they have their professional, their physician or their healthcare provider do an in-house kind of breast exam, more detailed, a little more specific. And then starting from age 40, the American College of Surgeons and Johns Hopkins University and the people who really advocate for women doing breast exams, they usually say for an average risk woman, starting at the age of 40, that they start having mammograms along with annual professional exams done in the office.
Now, am I wrong about this, or is that a younger age than it used to be?
The things have changed quite a bit, depending on who you talk to. But, I think following the experts, the American College of Surgeons, the American American College of Radiologists, they're the ones who really know, when the best time to be able to start doing those mammograms.
So if you are self-examining, which you should be at that early enough age, what are some symptoms, or what are some red flags that you should notice?
Right. So any type of enlargement, any mass that you might feel, and let me just say ahead of time, Gary, that most of the masses that are felt are benign. They're not malignant. So
don't be afraid to check.
Right, exactly. The most important thing is that if you identify a mass, that you get it examined professionally. Find out what it is. If it's just some fibrocystic breast, that's not a big deal. But if it's a cancer, we want to know early. The earlier you can detect it, the better the outcome will be.
And I certainly have a personal story to go along with that. My wife, her doctor noticed something out of the ordinary in the morning, and she was in having it checked out that very afternoon, and she is now a survivor for over 10 years. So, that really tells the story right there.
That's excellent.
What about risk factors?
So risk factors are some of the ones we see in other kinds of disease processes: obesity, drinking too much alcohol, family history of breast cancer, or a personal history of having abnormal breast pathology. That puts you at higher risk. Of course, genetics plays a role into it. And, as you know, with Angelina Jolie,
right,
she had her breasts removed so that would prevent her from, having breast cancer herself.
And that was because at a fairly early age, she found out she was on the list of people that had a relatively high probability.
Yes, and I think she tested even positive for the BRCA gene.
Okay. They're about to wrap us up, but you guys sent over an amazing graphic that explains something to me that I think it's a little hard to grasp, and that's the staging system. It's the different stages. We're showing it on the air right now. So there's 0, 1, 2, 3, and 4. You hear that all the time. I didn't really know what the specifics were for each of those stages.
Yeah, and just to be real quick, 0 means that the breast cancer is self-contained. Once they identify it as breast cancer, it's contained within that area, is not spread outside of that locality. It's much easier to treat. If you get to stage 4, that's called metastatic breast cancer. That's the one that starts to invade lymphatics, your lymph nodes, your bones, other organs in your body. So that's the most difficult stage to treat.
And the earlier that you detect this, the much better your potential outcome is.
Absolutely.
So if you have one thing that you want to suggest to people during Breast Cancer Awareness Month, what would that be?
Yeah, that one thing would be women, examine your breasts, and also men. We forget sometimes that men can also contract breast cancer. So get in the habit of examining your breasts. If you've already gone through your into menopause, put it on your calendar so you're doing it the same time every month, maybe the 1st or the 15th of the month. And that way you can detect if those little lumps kind of show up.
Great idea. Doctor, thanks so much for coming on Living Well. I think you save a lot of lives every month when you guys are on
My
here.
pleasure, Gary. Thank you.